Welcome to Lunchtime LaunchPad. I am Kayla, and I'm here with Krystie Dascoli, and we're going to be talking about reference-based pricing. It's all of this healthcare and medical things.
Whether you are a student or you are in the workforce, healthcare is something we all need. Right now, if you don't have healthcare, you are fined. My role is a human capital specialist. So I go out, I find new business. I typically look for groups with more than 100 employees. I bring them in, and once I bring them in, I have a service team that serves the day-to-day. Whether it's human resource issues, legal issues, benefits, we handle all of that. So when healthcare reform changed, we were hoping that it would really change the scope. So our clients, they had hoped they would see a reduction in cost, and they haven't. Year over year, we're seeing double-digit increases on our medical insurance. So the employee is always making less year over year over year, and at some point, something's got to give. We're kind of at a breaking point where we're saying we need alternatives, and there just haven't been great alternatives. So some trends that have kind of popped up have been like HSAs, which are those health savings accounts, right? You put money away, it rolls over, you use it for health care, so when you retire, you kind of have this pot of money for retirement. You also have health retirement accounts, right, which kind of work the same way. In an HRA, the money, if you take it out before a certain age, okay, there's taxation, okay. The days of HMOs where you would go to a doctor and pretty much you pay a $5 copay, that's gone. Now you have these, what we call high deductible plans, where you have to meet your deductible before the plan starts to pay. So my plan that I'm on at my work, and we have 35,000 employees now, we have a $6,500 deductible. So when I go to the doctor, I know it's going to cost me $280 every time I go to the doctor until I reach my deductible. If I have a baby, I'm going to pay $6,500 out of pocket before my plan starts to cover. Right? So most people don't know that. The federal government has a baseline for what all these things need to cost. Okay, so there is kind of a reference guide for what something should cost. Then the hospitals, the facilities can charge pretty much whatever they want. So typically an insurance company may pay 200% over Medicare.
Oh, but that sounds like a good deal to them.
Right, but they typically take 180 or so days to pay. So they might get more money in the long run by using Anthem, by using Blue Cross, by using whatever. They may make more money over time. But with us, when you use a reference-based pricing, they're getting paid in 7 to 10 days. They're still making more than they would on a Medicare patient, and typically Medicare is about 50% of their business. Basically what reference-based pricing is it's a reimbursement that uses Medicare and a cost to determine the services. So they're making more, so we're still paying them, they're still making good profit, and now we know what we're really paying. The employees' premiums go way down, because now we're not paying 200 or 300% for that knee surgery. We're paying Medicare plus 40% or 60%, whatever we're negotiating with that facility. Right now you have networks. You have to, when you have a medical plan, you have to work within a network. Reference-based pricing takes out the network. It gives you choice. You can go anywhere you want. You own your own business and you're growing and you're excited to grow, and you get more than 100 employees, and now you have to offer benefits to all those employees. With reference-based pricing, now there's no network. You can still have the same medical plan designed the way you want, so the employer can design their medical plan however they want. Same thing, they can keep it exactly the way they have it, but now it's based on Medicare times 140 to 160. Now we know what we're paying for those services. An employee, we give them an app. So literally on their phone, the doctor says, I need you to go in and get your knee surgery. They look up knee surgery. It'll pull up all the hospitals in a 50-mile radius, and it'll say, if you go to this one, 100% covered, 100% covered, 100% covered. An app supports what we're trying to do, and it teaches them the cost and where they're going to go and have a free service.
So coming back to entrepreneurs, what do you think is the most relevant thing to them?
When you guys start a business, what do you think your #1 expense is going to be? Human capital, right? Your people, the people you're hiring, right? That's typically the #1 expense. The second expense you're going to have, the largest expense you're going to deal with as you grow, and especially if you grow over 50 employees, is going to be your medical. I feel like I'm pretty entrepreneurial, and ever since this happened, I sit at night and I'm like, what could I design? What system? Who would I need to know? Be one step ahead of this to create something, whether it's for the individual user or something of that nature. I think that this is going to be huge. When this starts to take off, it's going to be huge.